Are you and your family? Hashtag Fit to Live. Hi, my name is Steve Murray. I'm the co-founder of Health Architects South Africa. I have a big interest in preventing, treating, and in many cases reversing chronic disease with lifestyle change. The press is full of information about things you can do to improve your health, like smoking less, eating more healthy food, managing your stress, your body weight, your blood pressure, and your cholesterol. These are all really important things, and I don't want to minimize any of them in any way. We know that 8 out of 10 deaths in South Africa can be attributed to chronic diseases of lifestyle, which means that they can be prevented in the first place. So my question is, what treatment should come first? What has the biggest impact on health outcomes? What has the biggest return on investment or bang for your buck? So I looked at the research, and I must credit Dr. Mike Evans for this original work, and my friend and colleague, Professor Georgie Torres, for this amazingly powerful treatment. And because of its breadth and ability to impact so many health conditions, we like it as a treatment for chronic disease. So let's look at the scientific literature about the impact of this particular medicine. For patients with cardiovascular disease, the medicine reduced the chances of dying from cardiovascular disease by 45%. If you take this medicine, your chance of developing cardiovascular disease in the first place reduced by 30%. If you take this medicine, your chances of dying from certain cancers can be reduced by 30%. For patients with pre-diabetes or metabolic syndrome, this medicine completely reversed the condition in 88% of patients. If you have diabetes, irrelevant of age or weight, this medicine reduced the chances of dying by 66%. For patients suffering with depression, this medicine improved the symptoms of depression and anxiety by 47%. If you're overweight and you take this medicine, you reduce the chances of dying from the associated cardiovascular disease by 66%, even if you don't lose weight. So what is this amazing medicine? Well, the answer is something that Big Pharma, and maybe even your own doctor, might not want you to know. The medicine is this mysterious CRF, or Cardiorespiratory Fitness. The most important thing to understand about CRF is that despite what is portrayed in pop culture, it does not mean that you need to be a marathon runner. So let me explain how it works. You may hear some new terms here, but they're actually fairly simple to understand. If you have a CRF of less than or equal to 6 meds, this should have you raising the red flag, both personally and with your doctor, because your chance of developing chronic illness increases between 41 and 56%. So the objective should be to achieve a CRF of at least 10 meds, equal or greater than 10 meds. This is where the magic happens, and the magic benefits happen. If you are then able to increase this by even 1 med, the health benefits continue to increase by 12 to 21% over and above the original 10. So what is this med thing? I can hear you ask. Well, this is how sports scientists like me measure the ability of your heart, your lungs, your blood vessels, and your muscles to deliver and utilize the oxygen that is in the air you breathe. It's really as simple as that. The critical thing is, like all medicines, the dose and the type is important to ensure that you get the correct effect. Telling you to simply go and get active is like your doctor telling you, here's some pills, just take them. But not telling you what they are, when to take them, and how much you need to take. The good news about this is that we can test your CRF in a very simple and non-invasive way. It also means that with some good advice and education from an exercise medicine accredited health and fitness professional, exercise scientist, sports science, biogeneticist, it means that we can help you prescribe the exercise that meets the type and dose of exercise specific for your condition or level of risk. This will ensure that you achieve your optimum CRF number and stay there. Can you see that the power is in your hands to be able to significantly influence your own health by taking a medicine that is universally available and free? So my question is, can you afford not to know your CRF and not to take action to get to your optimal CRF? Like many other key health indices like your cholesterol, your blood pressure, your HIV status, your CRF number is critical to know, to understand and to maintain throughout your life. Every breath that you take at an optimum CRF protects you from the onset and development of chronic illness. And we know that they are responsible for 80% of all deaths. Me and my team at Health Architects have a singular passion and focus to help you get to your optimum CRF level and keep you there. Talk to us today and find out what your CRF number is.